Assalamu alaikum, everyone. Welcome to the Emotional Evolution podcast. This is Fatima, clinical psychologist.
And this is Amira. I've done over 10 years worth of trauma healing and intergenerational trauma work from a coaching perspective. And today we want to address a topic that is called
the effectiveness of different types of therapies.
Yeah, there's so many different types of modalities of therapy.
Yes.
And yeah, you go ahead and then I'll.
So yeah, actually we just sort of started talking now about it. So I was just saying I've read a whole book on this, looking at what types of therapy are effective, what makes one more effective than the other. And in that book, we know that the most research therapy, it's called cognitive behavioral therapy. So that's that here and now approach that you go to any therapist. They're mostly trained in cognitive behavioral therapy, which is looking at the impact of our thoughts, looking at that impact on our feelings and how that influences our behavior. So what studies have actually found is that there's an over research on CBT. So that's why, because there's more studies on it, it's more researched, that sometimes influences why it's so effective or why it's shown in the research to be so effective. But there's actually something called common factors. So looking at different types of therapy. So some of the therapies that focus on what happened in our childhood, I don't know if you want to explain that, like schema therapy and psychodynamic. Maybe you can explain it.
Yeah, like my lens on it is, I guess I've got a few different lenses on it. I do believe that where our brain, it gets wired from 0 to 6. And what we're constantly exposed to is creating new pathways in our brain. Just like if you had a banana and you got sick and you threw up, you're going to associate something negative to the banana. And in the same way, whatever relational dynamics you have, if they were positive or negative, you're going to start associating in your subconscious negativity and positivity. So when I do work with people, I like to work from that intergenerational trauma lens, that inner child lens. So I do believe when our emotions come out, often I like to look at it like there's a younger part of us that's coming out. It could be a part that was a 6 years old or 16 years old. And we look at how, like, what age does your emotions look like? Like, are you kind of crying like a 6-year-old? And we can, like, some adults can feel like they're sobbing like a 6-year-old or they're having a tantrum like a teenager. So I do it from that lens, opposed to, I know you'll more commonly do like the CBT lens.
I actually, if I fully disclose, I do end up touching on some of the childhood stuff. And when I see people are stuck and it's like a very entrenched pattern and 8 weeks of CBT is not going to work, then I will ask the questions around, when did this feeling first develop? What did you have to do at that age? What does that sort of person look like? In order to sort of go a little bit deeper and get unstuck. But I guess the main thing from this book, it's called The Great Psychotherapy Debate. It looks at the effectiveness of the therapies is basically determined by all these factors. It's called the common factors approach. So some of those factors were, how warm was the therapist? How accepting were they? How empathetic were they? Was the type of therapy that they explained, like here and now or childhood, was that something that you felt like was going to be effective for you? Does the therapist actually believe in the therapy that they're delivering themselves? That also influences outcome. And then different things that we discussed previously in previous podcasts, like how much awareness the person has, how they're implementing the strategies to help manage their thought processes, their behaviors, all these factors. So despite the type of therapy, it might just be like, for example, some person identifies with religion more, so they need somebody that does incorporate, acknowledge and address their spiritual belief systems, and they have an understanding of that. So that's going to feel more effective for them.
It really reminds me of, like, even in parenting, like connecting before correcting. So the more you can like genuinely connect with like your patient, for example, and my client, for example, the more you can, and I think it's in any relationship, the more you can genuinely connect to someone's perspective, even if you disagree with them, or even if you're not like in that same issue with them, the more they can feel the trust coming from you, and then the more they'll feel like they can trust you to help them get out of this issue. So I think it's a really logical thing too. It's with anything, like if someone bought a handbag and you can see that they are just like so happy with the purchase, they find that it was so cost effective and it's so practical, and they keep ranting on about it. You can see there's like a genuine like they're genuinely pleased. You're going to get influenced.
Yeah.
So I think I love doing like reading up on studies on influence as well, especially when you're a parent. Like you want to be able to positively influence your kids. And I think the more you can genuinely join someone in their feeling, that they're definitely going to shift. So sorry, I'm actually going off tangent.
No,
now.
it's actually that's part of the common factors of, they call it therapeutic alliance. So how much you feel like you could trust and be open with your therapist. So it's a safe space for you to discuss your vulnerabilities. You can also be challenged by your therapist, but you feel supported by them.
Like
so
you know that you're in safe hands. Like they're not going to use anything against you. Like it's I guess you're in what the way I do the work is, I would label it as, you're recreating a healthy parental dynamic with them. Because the lens I take is whenever we're getting emotional support, we're learning how to reparent ourselves in that area. And that's not to say that we're putting down our parents by saying that. It's just to say that our parents are also human. Our parents are human. We can't expect them to get it all right. And they are going to make mistakes. And that's why I think it's useful to be open to these different modalities and these different dynamics. I've
even done more research into this, where they've said over the years, because therapy is something that's newly evolved, like maybe in the past, 200-300 years. But before then, there were aspects that people would turn to, like an elder that had a lot of wisdom, that could see the pain that they're going through and could acknowledge and give them really grounded advice based on what that person valued. Community connection. So like for depression, or even like for depression, certain communities, like they have a gathering of having tea together, and in that way they end up socializing, they get interaction. So there's different ways we can get those needs met, but therapy is it's sort of over time we've looked at the threads of what makes it effective, and it is like, looking at the values of the person, looking at what's keeping them stuck, empowering them, having that safe space.
Having that non-judgmental like space for them to work through their issue, where you can like hopefully reassure yourself that whoever you're working with isn't going to react all over the shop with you. They're not going to have a meltdown. They're not going to get angry with you. They're not going to criticize you or judge you or blame you or shame you in any sense of the word, that they're there to solely help you through your issue. I think that's a really important factor. I like to also weave in I think it also what's effective, or why therapy sometimes doesn't work, is because, like I mentioned, the different modalities, but I want to mention the modalities from a slightly different lens. Like I noticed that there's a talking type of therapy opposed to, for example, I like to sometimes physically do something with my clients, in the sense that I like a lot of visual meditations, and people might feel like that sounds so strange, but basically what I've learned is our body doesn't know the difference between what is imaginary and what is real. So sometimes when someone's gone through something really, really heavy and they keep reacting a certain way, for example, you may know someone, they just have like a resting angry face. We have all heard of those people. We've all seen those people. And so, you can actually help shift that. That's actually an emotional pose that they've taken on from probably a trauma or a repeated trauma. So they're not just an angry person. They can change. There's a reason why they're so angry, or there's a reason why they're so hurt. Or you might know someone who's always looking meek. And you're not just born completely meek.
What does meek mean for people that don't understand?
Good. Like they look like they're shut down, they're timid, they may be really mumbling and whispering. They're the one that doesn't want to put their hand up if they've got a question. They rather not even have a voice. They rather just be quiet and just go with the flow. Mm-hmm. And in saying that, they might not feel happy. They might feel like, because they can't use their voice, or they feel it's too hard to speak up, that they just get treaded over. So these kind of emotional kind of blocks that people have, that we can kind of see in a person, that sometimes isn't resolved through talking. That's resolved through doing something physical. And like I have like a whole host of like different things I use that people can physically do to shift out of it. And I just wanted to mention that. And that kind of line of work where you really explore how your body is taking something on, it's called somatic therapies. So I love somatic therapies because I feel like even if you don't understand an issue, but you just address the somatic bits and pieces, you'll still get a change, or you get a much faster change, because we kind of hold everything in our body. And one way of describing it is like you feeling annoyed at someone, but you're not showing them that you are. Like you still feel the feeling, you still feel annoyed, even though you can pretend that you're like all loving and happy. Like an example is like you're feeling annoyed that your kid wiped chocolate cake all over your white lounge. And you know that you should be talking to them in a polite way because you don't want to, you don't want to be that mother that shouts. You're still feeling angry. So I obviously give people strategies on how to deal with feelings inside and how to really observe the feelings, because that actually gives us a lot of psychological knowledge. Like our body does a lot of talking. And I really like that mode of therapy. I find it's like if I can find someone that knows how to tap into like feeling into their body, I feel like I get excited for them because I feel like the work then just becomes really, really fast.
Yeah, a lot of deeply entrenched patterns can be resolved. Like if there's somebody that's coming time and again to do, like, for example, cognitive work, but half the time I've had a few people like having mind blanks, or they're feeling like they just feel too sick, or when they get in touch with their emotions or their past memories, they actually feel like they can't function. They're feeling nauseous. It's too scary. They can't sleep. Then in those situations, that's where we're talking about like tailoring the type of therapy. So more of a somatic, or more of a a non-cognitive bodily approach is going to be like a lot of movement sort of incorporation is really effective for a lot of trauma-based conditions.
Even anxiety, like if you're stuck feeling anxious,
debilitated high chronic anxiety where it's too much to even think, or depression where it's too much to do anything. Sometimes there's different types of therapy that help address the bodily aspects more, or you can focus on that part of that in the session. But I guess that's probably where you want to ask these questions of your therapist or your coach. What sort of areas of focus what sort of approach do they use? And, if you've had a previous history, then it can sort of prevent you from circling into that same sort of approach that's not going to be helpful.
Yeah, I guess that's what we don't want. We don't want you to do a type of therapy and say, I've done it and it's still not working. I guess what I'm actually saying is that if you've done one approach, perhaps the other approach will help. Or maybe the third approach will help. And I know it can feel frustrating that you're not just getting the answer that you want. But if you look at it like, actually, I'm equipping my mind. If I'm doing CBT, I'm equipping my mind with the knowledge. Now I'm going to someone else. I'm going to deal with my body. Like looking at how can I actually get emotionally equipped, because it is something that is going to, like, you live with your emotions every day and you live with how you feel every day. And it's something definitely worth investing the time with. And we would never want you to walk away feeling like you tried it all and it never worked, because I don't believe that's ever true. I don't believe that you could try it and it just does not work. It just may mean that a different approach may work for you. And that's the main message.
Yeah. And I think a thorough and a responsible practitioner will give you a pointer towards what's going to be helpful, based even in a 10 to 15-minute assessment that I do with someone. I will already give them straight off the bat recommendations. It sounds like you've already done this, or it sounds like this is going to be too difficult at the moment. So I would recommend this approach. So definitely be open about your concerns as much as you feel comfortable, and ask your practitioner what approach they feel like is going to be more. Basically, don't be afraid to ask the questions, so it doesn't set up this like what we call experience of quote unquote therapeutic failure, or like therapy failure, where it feels like nothing's going to work because we tried something that actually wasn't a match to our needs and what our concerns were. So don't be afraid to ask the questions and refuse certain recommendations that you feel like might not be helpful, and get a few opinions and see what what you're guided towards.
Yeah, I had a funny analogy come in my mind. Like, it's like walking into a clothing store and saying, and trying on the clothes and then being like uncomfortable and tight, and then just concluding that all clothes are uncomfortable and tight. Like, that obviously can't be the case.
Yeah.
So you just go to another store, another brand, you try and find like what brand does like comfy clothes, that you're after, and you will inshallah find it. So that's the main message. We hope you benefited from this session. And
I just wanted to add one thing quickly, in terms of, because I know I hear a lot that sometimes you're not a fit with the therapist, they're not understanding your needs, and just to be aware that if there's a therapist that you feel like there is a misalignment, they're not understanding you, you're asking the questions and you feel like it's sort of you're being pulled in a direction and they're not hearing you out, that might be a bit of a sign that you might need to switch. And that's a normal part of the journey, trying like fitting, like putting on something for size and seeing if it fits or not. And then it can sometimes take a few rounds to find someone that's aligned with your values and is understanding you. And it's unfortunate that's a bit of a hit and miss, but I just want to encourage people to not be disheartened, knowing that, inshallah, eventually they will find something that's suited to them, and just, to advocate for yourself and keep going, inshallah.
Yeah, it's definitely not worth like suffering in silence. It's much better to, becoming like equipped with this knowledge, but doing that window shopping, as you've mentioned, and inshallah, you'll get that right answer coming for you, inshallah. Anyway, we hope that this was beneficial in some sort of way, and we'd love you to do the usual, all those good things like sharing, and subscribing, and hopefully we will see you in another episode.
Inshallah. Take care. Assalamu alaikum.
Wa alaikum salam.